Welcome to Businessworld's series on sustainability. We are here today with the Country Director of the Bill and Melinda Gates Foundation, Dr. Nachiket to talk about goal number 3 is about ensuring healthy lives and promoting well-being. Welcome, Dr. Moore. Thank you for being with us today. Tell us a little bit about the foundation and the work that the foundation does in India.
We've been here almost 15 years now. It was one of the earliest interventions that the foundation got into. Initially focused on a very specific disease called HIV/AIDS, in which we partnered with the government to try and see if we could, really control the spread of the disease. Since then, the foundation has worked with government in various areas that we think are important to the government, and that broadly fit into where what we in the foundation like to call we have IQ, where we have some understanding, something that we can bring to the table that adds value.
You have spoken about taking a health systems approach. For our viewership, can you tell us a little bit more on what this approach is?
We sitting in India tend to be somewhat self-critical, but the reality is that we have made impressive gains. It is true that perhaps the MDGs we may have missed by a whisker, but the reality is that maternal mortality rates have come down by a multiple, they're 4 times lower than they were 25 years ago. Infant mortality rates, we used to think of infant mortality rates of 200, that is 20% of all babies would die within the first year, right? That number today, even in some of the poorest states, is 4%, 4.5%. Now the challenge is that if we were to go to the SDGs and we were to say that we are now going to take that number in the next 15 years to a number like 1.2% or 1%, right? That journey is going to require many more levers to start to operate. And what a health systems approach does is that it examines all those levers. We may need more money, we may need more doctors, we may need more technology, we may need to worry about supply chains, we may need new ways of regulating the system. The earlier approach could take a piecemeal approach to say, let's focus on health workers. And that's enough to get us from maternal mortality rate of 500 to 200. But now if you tell me, no, I have to go from 200 to 50 or 40 or 10, that needs many more levers to be brought in. And a health systems approach is just a fancy way of describing trying to take this multidimensional problem and then solving all of those issues in a consistent manner. Because if you fixed one, but the other solution didn't kind of ally well with it, you would end up with a badly functioning outcome.
Is there a role for the private sector in achieving these targets over the next 15 years?
I mean, clearly there is. The reality is that if I were to ask the question today, what proportion of total health care of the country is provided by the private sector, you might say that already the private sector is the dominant provider, right? Can it do more? Certainly it can do more, right? But if I were to, ask the question, that is what happened in the outcomes we see has happened I didn't do anything on its own, it just grew and grew, what one would call laissez-faire, right? If I were to say, no, I'm going to sit down here as the government, as a policy maker, and we are going to design a health system. And then you were to ask the question, in that designed health system, should we make it happen, what would be the role of the private sector? Clearly, it's a set of choices we will have to encounter. If I look at the UK, for example, as a system, well-designed system, the private sector exclusively provides primary care. It's contracted in by the government, though. So it's a government-private relationship that exists. Yeah, many countries around the world don't have a public sector at all. Japan, it's entirely a private sector system. The government's role is to make it happen, to control prices, to make sure customers are well protected, but they don't run anything. By contrast, if I look at Turkey, it's almost entirely public sector run, but run in a high quality manner. My own sense is in India, as we evolve, state to state, we will see a differential solution. I think states like Kerala are already seeing a well-functioning, high-quality public sector and a well-functioning private sector.
If you had to select 2 or 3 really great technological innovations that you think are going to help us leapfrog, for example, in the area of child and maternal health, what would you pick? What would you identify as sort of the key technologies we need to adopt and scale across the country?
I think what has happened in technology, particularly in health, is that you've seen what I would call technologies with a lot of kind of modernity, a lot of innovation kind of built into it. But the challenge has been that the core backbone on which this must sit does not exist. And in fact, in some ways, across sectors, if I compare telecom, if I compare banking, if I compare railways, if I compare income tax with health, right? Because many of these are public sector actually. Health seems to be uniquely underusing core backbone technology. So for example, today, if I'm a woman that goes to deliver a baby in a government hospital, right? Very likely the government has no idea. Am I diabetic? Am I hypertensive? Is this my 25th child? They don't know, right? They are just treating me as somebody that they saw for the first time, right? Now that is terrible, because if I was indeed diabetic, if I was indeed severely anemic, the way you would treat me would be very different from if I was a completely normal person, right? And oftentimes women are coming to government hospitals an hour away from the baby being delivered, right? So there's no time to do all the workups and all of that you might imagine, right? I personally think that, that core backbone we will have to build. There is no way, and every country has taken a different pathway to it. US, for example, had equally similar challenges. Hospitals were not using technology. Government intervened to give specific incentives to hospitals to switch to using health management information systems, to switch to using electronic health records. I think we will have to think about such mechanisms both within the government and within the private sector. But for example, prematurity is a big issue, and we need to understand how to deal with prematurity if we are going to get to our SDG goals. Right? Babies that are born premature, you may have the sense that babies grow inside the mother's womb and don't breathe, through their nose. So as a result, the lungs develop last. A premature baby has underdeveloped lungs because the time to develop the lungs, was not given to the baby. And when the baby is born, she's not able to make it because the lungs are not properly developed. Right? Now there are new technologies being researched that can help us detect prematurity inside the womb of the mother and then act appropriately so that when the baby is born, we're able to deal with this issue. So I think these are some technologies that are still not quite with us, but I'm eagerly looking forward to where they are able to help us.
The key to success with the SDGs is really getting the state governments to adopt them. Give us your thoughts on that. How can we encourage states to really...
My understanding is that the social sector is really important to state governments. I don't see that the governments are not interested in the social sector because they recognize that a large part of their electorate is and will be for some time, even if not dirt poor, still quite dependent on the state, on public services for making things happen. Right? So I'm not seeing that as a challenge. I think the bigger challenge though is within the social sector, what do you focus on? What is your, and clearly that's a choice every state government will have to make. Sometimes in states there is a temptation to prioritize those issues that there is a belief will have a political payoff much more quickly than issues that will have a political payoff. But it takes time to build out that structure. And to some degree, I would say health suffers a little bit from that perspective. And which is at the central level, you got a certain design, right? That even if it was a small amount of money that went to the states, right? That was able to propel the states in a particular direction, right? With that design element going away, we might lose some of that focus. But equally on the other side, I would say what has happened because of the central design is that you get identical health systems in a country where actually there's enormous diversity. If I were to look at, for example, big important causes of death in Bihar, there still are maternal child health type issues. In Tamil Nadu, you're seeing suicide rates actually amongst young people as becoming a very important cause. In Bihar, it makes a lot of sense to put money in to a scheme that persuades women to go to hospitals to deliver babies, because that's where we can take good care of them. Tamil Nadu, they're already going there. Why would I need to give money to women to do that? Right? Instead of offering unipolar depression counseling services to these very same women, because they are the big sufferers, in a primary care setting. Right? I think that this decentralization will finally give the state governments the empowerment to say, you figure out what makes sense for your people. And it will take some time as people start to understand this issue, but I'm certainly hoping we will end up in that direction.
Is there one policy, if you had to sort of personally say, this policy I think is going to make the big difference?
So, it's hard to pick one. Clearly one of the areas in which I've written about also, and is something that I think is an important concern area, is we need more money for health. Government spends approximately 1.5 lakh crores, state plus center. What we need the government to be spending is in the neighborhood of 4.5 lakh crores. Right? That's the difference between the money that they give us and the money that we need at roughly 3% of GDP. Right? The question is, where is the money going to come from the government? If I go to the government and say, give me this money, what I'm told quite rightly is that we have a limit on tax to GDP ratio. As a country, jobs, income protection matter perhaps a lot more today. As we cross a certain income per capita, maybe those will become less important and health will naturally rise to the surface. Right? So that could be a restriction there. Countries that have faced similar situations, it's not necessarily just poor countries, Germany being an example, right? As a country that faced a similar situation, said, okay, why don't we make it mandatory for every individual that can afford it to buy some form of health insurance that will ensure that there are low-cost products out there. The government can then focus on the poor and buy the same insurance. Now, of course, insurance doesn't mean private sector. The insurance can get pooled with the government's own money and can then be used to build out a high-quality public health system. Just because it's called insurance doesn't mean it has to become private sector. It's a mechanism by which people contribute money in. Because my sense is that we can't be proceeding in neither of the two directions. Either we say government will fund it, the UK style tax-financed health system, or German style, in which the government will do its bit for poor people. People will be required to contribute into a central pool to make it happen. So at least that will give us enough money. Now, will that solve all the health issues? I'm certainly not going to be naive to tell you money is all that we need. We certainly need money, but since you asked me to pick one.
Thank you, Dr. Moore, for that very rich discussion. And we are certainly looking forward to hearing a lot more about the Foundation's work and the kind of results that are going to come out of all of these different and interlinked efforts that you're taking on. Thank you for giving us the time, and we look forward to hearing more.
Thank you very much. I enjoyed talking to you.
Thank you.
We at BW Businessworld are committed to transforming this country through BW sustainability.
In 2015, 193 countries signed the SDGs. 17 goals: poverty, gender equality, climate action, zero hunger. 169 targets. Together, we will achieve the 2030 agenda.